Alright, azathioprine. It's metabolized to the active compound mercaptopurine, purine synthesis inhibitor, inhibiting the proliferation of cells, especially leukocyte lymphocyte. It's an effective drug used alone in certain autoimmune diseases or in combination with other immunosuppressants in organ transplantation. Caution should be exercised when it's used in conjunction with purine analogs such as allopurinol. You may give only 25% of the usual dose of azathioprine. Thiopurine methyltransferase (TPMT) deficiency is present in about 1 in 200 people and predisposes to azathioprine related pancytopenia. A thiopurine TPMT test may be needed to look for individuals prone to azathioprine toxicity. Adverse effects include bone marrow depression, nausea, vomiting, pancreatitis. So basically, it inhibits the proliferation of leukocytes and lymphocytes. So it's useful in autoimmune diseases. So let's move on to the next medicine, drug methotrexate. It's an antimetabolite which inhibits dehydrofolate reductase, and an enzyme essential for the synthesis of purines and pyrimidines. So very important for TRN synthesis. Uh, so inhibiting this one may cause lack of purines and pyrimidines. So indication. So indication is rheumatoid arthritis, psoriasis, ALL, and the adverse effects can be mucositis, myelosuppression, pneumonitis, and liver cirrhosis. And pregnancy. Men and women should avoid pregnancy for at least 3 months after treatment has been stopped. So better to avoid pregnancy. Okay. Prescribing methotrexate. Methotrexate is a drug which with a high potential for patient harm. It's therefore important that you are familiar with guidelines relating to its use. Methotrexate is taken weekly rather than daily. Weekly, of course. We see in SLE sometimes. Fasting blood count, full blood count, urea and electrolyte LFTs need to be monitored regularly. The Committee of Safety of Medicine recommend FBC and renal and LFTs before starting treatment and repeated weekly until therapy stabilized. Thereafter, patients should be monitored every 2 to 3 months. Folic acid 5 mg once weekly should be co-prescribed, taken more than 24 hours after methotrexate dose. The starting dose of methotrexate is 7.5 mg weekly. 1 month strength of methotrexate tablet should be prescribed usually 2.5 mg. Only 1 strength of methotrexate should be prescribed. Avoid prescribing trimethoprim or cotrimoxazole concurrently, increases risk of marrow aplasia. Okay, some other medicines like mode of action and medicine. Mycophenolate mofetil inhibits inosine monophosphate dehydrogenase. Azathioprine metabolized to the actively compound mercaptopurine, a purine analog that inhibits DNA synthesis, purine synthesis inhibitor. And methotrexate similar antimetabolite which inhibits dihydrofolate reductase. You have to remember the mode of action. Okay, rituximab, another important medicine. For rituximab, if you know, the indications are non-Hodgkin's lymphoma that we have seen over time. Patients having non-Hodgkin's lymphoma take rituximab. Refractory rheumatoid disease, used off-label to treat different difficult cases of multiple sclerosis, SLE, and autoimmune anemias. Pure red cell aplasia, ITP, Evans syndrome, vasculitis. Adverse effects can be flu-like illness, decreased BP during fever, tumor side pain. Okay, next medicine is finasteride. Is an inhibitor of 5-alpha reductase, an enzyme inhibitor of this, an enzyme which metabolizes testosterone to dihydrotestosterone. So if you inhibit this, then dihydrotestosterone is not produced. So testosterone to dihydrotestosterone. So this 5-alpha reductase causes this, but inhibiting this is finasteride. Okay, so indication is BPH, male pattern baldness. Adverse effect can be impotence, decreased libido, ejaculation disorder, gynecomastia, and breast tenderness. Finasteride causes low levels of serum prostate specific antigen, PSA, low PSA, so it can decrease PSA. Okay, sildenafil is another medicine, phosphodiesterase type 5 inhibitor. It's used in the treatment of impotence. Viagra contraindicated by nitrates and nicotindale. So nitrates and nicotindale you don't give Viagra if this is prescribed. Okay. Then nicotindale has a nitrate component as well as being a potential channel activator. BNF recommends avoiding alpha blockers for 4 hours after sildenafil. Okay. Adverse effects are visual disturbance. Okay. The visual disturbance basically blue discoloration, as you can see. Then non-arthritic anterior ischemic neuropathy, nasal congestion, flushing, gastrointestinal side effects. Contraindication: patients taking nitrates and related drugs such as nicotindale, hypotension, recent stroke or MI, non-arthritic anterior ischemic optic neuropathy. All these contraindications for sildenafil. Next important medicine would be octreotide, another important drug. Octreotide is a long-acting analog of somatostatin. Somatostatin is released from D cells of pancreas and inhibits the release of growth hormone. So analog of somatostatin. Indication is acute treatment of variceal hemorrhage. We see that very often. Acromegaly, carcinoid syndrome. Prevent complications following pancreatic surgery. Then bivipiomas. Gallstones. Adverse effect can be gallstones. Okay. Secondary to biliary stasis. Okay. Proton pump inhibitors are a group of drugs which profoundly decreases acid secretion in the stomach. They reversibly block the hydrogen. Okay. They reversibly block the hydrogen potassium ATP enzyme system of the gastric parietal cell, including omeprazole and suprazole. We all know that. So proton pump inhibitor. Okay, next is aminosalicylic, also another important medicine. Is released in the colon and is not absorbed. It acts locally as an anti-inflammatory. The mechanism of action is not fully understood, but 5-ASA may inhibit prostaglandin synthesis. We have several of them like sulfasalazine, mesalazine, also olsalazine. So sulfasalazine is a combination of sulfapyridine and 5-ASA. Many side effects are due to sulfapyridine moiety like rashes, oligospermia, headache, Haynes body anemia. Other side effects are common to 5-ASA. See mesalazine. Mesalazine is a delayed release form of a 5-ASA. Side effects seen in patients taking sulfasalazine are avoided. Mesalazine is still, however, associated with side effects such as GI upset, diarrhea, headache, agranulocytosis, pancreatitis more common, interstitial nephritis. And olsalazine, 2 molecules of 5-ASA linked by a diazo bond is broken by chronic bacteria. Pancreatitis is 7 times more common in patients taking mesalazine and sulfasalazine than sulfasalazine. So something to remember. Okay, moving on, we are almost close to the end of pharmacology. Not the end, but very close. Immunoglobulins therapeutics. Okay, so IgG, that's what we call it. So indications are what? Primary and secondary immunodeficiency, ITP, myasthenia gravis, GBS. This is where we see it more often. Kawasaki disease. Then toxic epidermal necrolysis, pneumonitis induced by CMV following transplantation, low serum IgG levels following hematopoietic stem cell transplant for malignancy, dermatomyositis, chronic inflammatory polyradiculopathy, all these, CIDP, CNAs as well. Basics: form from large pool of donors. So IgG is something very expensive as well because you have a lot of donors, almost 5,000 people giving it for one bag. IgG molecules with a subclass of distribution similar to that of normal blood. Half-life of 3 weeks. Okay, coming to a very, very important topic right now, antimicrobials like antibiotics. So we have to remember the mode of action as well as the names of the antibiotics which are there. So firstly, coming up to the first group 1. Group 1 is about inhibiting the cell walls, like penicillin, cephalosporin, isoniazid, vancomycin. Okay, they always target the cell wall, these antibiotics. So these are all there. Okay, so that's inhibit cell wall formation: penicillin, cephalosporin, isoniazid, vancomycin. Always have to remember this. Number 2, group 2 is inhibit protein synthesis, Okay, by acting on ribosome, whatever. Now let's see aminoglycoside like amicus and gentamicin. Okay, uh, inhibit protein synthesis. Okay, chloramphenicol macrolide like erythromycin, azithromycin, clarithromycin, macrolides, tetracycline, fusidic acid, linezolid, uh, queen, pristine. Okay, so you have to find some way to remember, like how will you remember that it inhibits protein synthesis. All these medicines like linezolid, aminoglycoside, macrolide, these are very commonly used medications. So we have to find a way to find out, like, what, how we're going to do it. Group 3 is about inhibiting DNA synthesis. It's like quinolones, very important. Ciprolevomero, moxie, sorry, ciprofloxacin, levofloxacin, moxifloxacin. It's very important. Metronidazole, inhibit DNA synthesis. Sulfonamide, inhibit DNA synthesis. Trimethoprim, inhibit DNA synthesis. And then inhibit RNA synthesis. So this one, group 2 was protein synthesis. This is DNA synthesis. This is RNA synthesis. R is very easy, rifampicin. Straight. So these four, this whole group is the most, it's very important, I have to say. Very, very important. So you have to memorize this whole group. Like I'm telling you again, inhibit cell formation, penicillin, cephalosporin, isoniazid, teicoplanin as well, vancomycin. Group 2 is inhibit protein synthesis, aminoglycoside, chloramphenicol, macrolides, linezolid. Inhibit DNA synthesis, quinolones, metronidazole, sulfonamide, trimethoprim. And inhibit RNA synthesis, rifampicin. Excellent. A great chart as well, I think, for MRCP. Okay, let's see bactericidal versus bacteriostatic antibiotics. As we know that bacteriostatic is basically preventing the growth of bacteria, and bactericidal is killing the bacteria. So which ones are killing, which ones are not? Killing antibiotics are penicillin, cephalosporin, isoniazid, aminoglycoside, metronidazole, ciprofloxacin, levofloxacin, rifampicin. You can have a quiz like which one is having what mechanism, like from the list itself. Like let me ask myself, penicillin, it inhibits cell wall formation as far as I know. This one also inhibits cell wall formation. This one is also cell wall formation. Aminoglycoside I think inhibits protein synthesis. This one I forgot. Metronidazole I think DNA synthesis. Also cipro level DNA synthesis, RNA synthesis, and this one I forgot. Okay, so all these are very important. And the bacteriostatic ones are chloramphenicol, macrolide, tetracycline, fusidic acid, quinopristine, dalfapristine, linezolid, sulfonamide, trimethoprim. So all of these very important. More important is that chart that you have. Okay, classes. A list of members of some antibiotic classes like macrolide may include erythromycin, tacrolimus, azithromycin, erythromycin. And aminoglycoside includes amikacin, gentamicin, neomycin, streptomycin, tropomycin. Okay, erythromycin was the first macrolide used clinically. So numeric examples include clarithromycin, azithromycin. Erythromycin may potentially interact with amiodarone, warfarin, and simvastatin. So this is something very important. May interact. Macrolides act by inhibiting bacterial protein synthesis, as we've studied before. The aminoglycosides, I think, yeah. It's our macrolides. Macrolides, yeah. So inhibit bacterial protein synthesis. If pushed to give an answer, they are bacteriostatic in nature. But in reality, this depends on the dose and type of organism being treated. Erythromycin is used in gastroparesis as it has prokinetic features, promotes gastric emptying as well. Okay, side effect of erythromycin, GI side effect, cholestatic jaundice. Risk may be decreased if erythromycin steroid is used. P450 inhibitor. And for quinolones, a group of antibiotics which work by inhibiting DNA synthesis. So something again important, DNA synthesis, ciprofloxacin, and are bactericidal in nature. So examples are already given, cipro and levo. Adverse effect, lower seizure threshold in patients with epilepsy. So this is something very important, like giving ciprofloxacin to a patient having seizure. It just decreases the threshold. And tendon damage can also occur. So quinolones, including rupture. The risk is increased in patients already taking steroids. Achilles tendon ruptures. Tendon damage is a well-documented complication of quinolone therapy. Something not very much known. It appears to be an idiosyncratic reaction, with the actual median duration of treatment being 8 days before problems occur. Quinapristine and dalfapristine antibiotics. Injectable streptogrammin antibiotic combination of group A and group B streptogrammin inhibits bacterial protein synthesis by blocking tRNA complex binding to the ribosome. Okay. Spectrum: most gram-positive bacteria, exception Enterococcus faecalis, adverse effect thrombophlebitis, arthralgia, P450 inhibitor. Almost to the end. Okay, linezolid. Okay, is a type of oxo. Okay, wait. Before that, linezolid is in which category? It's in group 2. Inhibits protein synthesis. So you have to remember linezolid. Okay, group 2. Okay. So it inhibits bacterial protein synthesis, written here already, through binding to sites on the bacterial ribosome and prevent the formation of functional 70S initiation complex, and is bacteriostatic in nature. So spectrum is highly active against gram-positive organisms, including MRSA, VRE, GISA. So MRSA, that's good to know. Okay, but the adverse effects are thrombocytopenia, reversible on stopping, monoamine oxidase inhibitor, avoid tyramine containing foods. Okay, the next would be sulfonamide. Sulfonamide are antibacterial sulfonamides act as competitive inhibitors of the enzyme dihydropteroate synthetase, an enzyme involved in folate synthesis. Other uses: the sulfonamide chemical moiety is also present in other medications that are not antimicrobials, including thiazide including hydrochlorothiazide, metolazone, indapamide, others, loop diuretics, sulfonylureas, and some COX-2 inhibitors. In addition to its use as an antibiotic, is also utilized in treatment of inflammatory bowel disease. Okay, sulfonamide is there. It's used in combination as well. Sulfonamide antibiotic combination of trimethoprim and sulfam. This one is cotrimoxazole. It's also used antibiotic combination of trimethoprim and sulfamethoxazole in the ratio of 1:5 is used in the treatment of variety of bacterial infection. The name cotrimoxazole is the British approved name and has been marked worldwide under many trade names, including Septra, Bactrim, various others. Sources differ as to whether cotrimoxazole is usually bactericidal or bacteriostatic. Anyways, okay, the last topic is diethylcarbamazine. Okay, so there are two women named ethyl in this car. So you can see the two women, diethyl car. You will notice that there is an elephant in between the ethyl and ethyl. So diethylcarbamazine. So treatment of certain filarial disease. So filariasis is elephant. This disease include lymphatic filariasis caused by infection by Victoria bancrofti, Brugia malai or Brugia tremori, elephantiasis, tropical pulmonary eosinophilia, and loiosis. So this is the end of pharmacology.